Hi, I'm Victoria Wilson. Hannah and I are going to talk tonight about our experiences with people who have bipolar disorder, borderline personality disorder. Sorry. So my experience is I have professional and personal experience. So my professional experience actually is in correlation with my personal experience. So one of my childhood friends, Chelsea, she has borderline personality disorder and bipolar disorder. And she was my patient one time when I was working on psychiatry as an LPN. Unfortunately, due to living in like a rural hospital, a small hospital with limited staffing, I don't always have the opportunity to not care for people that I know or not care for family members. So unfortunately, I had to be her nurse. And so my personal experience communicating with her was that in our friendship, I found that we would often make plans and then she wouldn't show up or she wouldn't follow through with what she said. So that was really frustrating for me. So then when she became my patient, I found maybe I was biased or, had negative feelings about, you know, her inconsistencies in her personal life. So when she was my patient, I found that I had a hard time um, believing that she was going to follow through with what she said she was going to do. And as we know in psychiatry, especially with borderline personality disorder, we're not necessarily going to fix that person's behavior or fix their symptoms just because they're in the hospital. Often with borderline personality disorder, we know it's kind of like stabilize and help with social issues and then try to reintegrate back into the public.
Mm-hmm.
So for me, communicating with her, because I couldn't see the follow through and I couldn't see the change on the unit, I didn't necessarily know, does she mean what she says? Is this working? Is this going to work? So that was really challenging for me. And then also another challenge that I had was that I found I had a challenging time setting limits and boundaries with her and with all borderline personality disorder people that I've really met. Um, I also have a hard time like maintaining, like sticking firmly to my boundaries because I feel like sometimes I have a difficult time identifying what is um, truthful necessarily or what is kind of exaggerated or fabricated. And I don't know if that's just me being uneducated or me having personal negativity about this diagnosis. But for me, the most challenging part is really just like maintaining strict boundaries and knowing this is okay to set this boundary. This is going to be helpful, even if I can't see the effectiveness or the change while they're under my care.
Mm-hmm.
So yeah, that was my experience mostly.
Hmm. I have very limited experience. I have no clinical experience with any personality disorders, but I did have somewhat of a friend that has personality disorder that I dealt quite a bit with probably about 10 years ago. So it's also very outdated, but yeah, just had to help her through some personal stuff. And I can recognize now that what I was lacking is the kind of like you're saying, like setting like the firm boundaries, and like if you want to use the set communication style that we learned last semester, those truth statements, like the support and the empathy comes very easily for me. It seems to come very easily for you as well, but then doing the those truth statements is a
Mhm.
little bit more difficult, but I think that that's something that we can both work towards for sure. Yeah, and then so I'm ready to work on that, as well as I feel that learning about the origin of like where these personality disorders like kind of come from, just within people's like genetics and environments and whatnot, has a lot to do with my approach.
Mhm.
Just because there is such a stigma around these clients being super difficult, whereas yeah, if there was a bit more of an understanding there, I think it'll be a lot easier for me to work with these clients, as opposed to what I hear other nurses saying, RNs and RPNs, about how challenging that can be. Not to say that it's not a challenge, but I don't know. There's just kind of, you know what I mean? There's
Yeah.
that that label of being difficult.
Yeah.
But
I
so yeah.
don't I think that the label of being difficult also makes it more difficult. Like when you're going into something and you already know it's going to be challenging or you think it's going to be really hard, like often it
Yeah.
seems a lot harder than it is, especially if you don't have like the tools or the education how to communicate effectively and like professionally with
Hmm.
someone with a personality disorder. Like it's so different compared to other mental illnesses. And especially if like those nurses have a medical background, that they're not like, I know for me, like unless I'm working on psychiatry, I don't have experience with clients who usually have borderline personality disorder
Hmm.
unless they're in for a medical reason and that's just a congruent disorder. But yeah, I think just like for me and probably for you too, it's kind of like the more you know situation. So once we understand more how to communicate, it'll be easier to maintain those boundaries and it'll be easier to be truthful and be sincere and also professional about our truths without feeling like, am I going to offend them or is that the wrong thing to say or was that too blunt? So
Yeah,
for me, like communicating, I realize that's a huge part of personality disorders, more so than probably anything that we're going to do for them on an inpatient unit or even in an outpatient setting.
for sure.
So having those strong communication skills is probably really essential.
Yeah. And then
Yeah.
I feel like the that document that was posted for this week's readings kind of gives like a list of all of the clusters and the specific diagnoses, and that each of those comes with its own set of specific strategies. So getting those in our toolkit will be super helpful as well, I feel.
Yeah, for sure. Yeah. And
Hmm.
like also just like when you come on the unit and you see you have a borderline personality disorder client, like knowing what cluster they are so that you know how to communicate. Like if it's
Yeah.
negative, how are you supposed to know how to communicate? So
Hmm.
yeah, having as much information as possible, I guess it's probably the most helpful way to know how to communicate the best way for them.
Yeah, for sure.
Mm. Yeah. Anyways,
Anything in closing?
I don't think so.
Good. Awesome.
All
Thanks,
right.
Victoria.
Thank you.